All right, thank you, Brittany. In the United States, testicular cancer is the most common malignancy among men aged 20 to 40. Risk factors for the disease include both family and personal history. Joining us now to talk more about testicular cancer is Francis Alba, MD, the Assistant Professor of Urology at the University of New Mexico School of Medicine. Thank you so much for being here. This is a really important subject. So, what groups of men are at the highest risk for developing testicular cancer?
Well, as you said, in the United States, it is the most common cancer among men aged 20 to 40. And the best described risk factors include history of undescended testicle, most importantly, but also family history and personal history of testicular cancer.
Okay. So, in terms of personal history, if we've developed it in the past, it could be something that's a recurring malignancy.
That's exactly right.
So once it goes away, it's something that we got to keep on.
Right.
Okay.
Exactly.
So. You said the undropped testicle. What are some of the things that we need to be looking for in terms of whether or not we're at risk, and also how is it diagnosed?
Most commonly, men present with a painless, palpable lump or mass within the testicle that they don't think was there before, and they will most commonly present with disease that is localized and non-metastatic. The most important thing, though, is that once a mass is suspected, they should seek prompt medical attention for an examination by a physician and to obtain an ultrasound of the scrotum.
Okay, so an ultrasound is typically the next step.
Yes.
Getting it done. Okay, so when we find that it's going on, we feel that this is done. What's the procedure? They do the ultrasound. They do find a mass there. What's the process of taking care of it?
The next step after the mass is sort of characterized on an ultrasound would be referral to a specialist, referral to a urologist. Okay,
and a lot of urologists working with UNM Medical Center and taking care of this?
Yes,
Yeah.
That's a common problem that we often treat.
Okay, so are there any screening guidelines that you would recommend for men out there?
Actually, no, the U.S. Preventive Screening Task Force actually recommends against screening for testicular cancer and even doesn't routinely recommend self-examination. And the reason for that is the low incidence of the disease and the very high likelihood of cure, even when it presents in an advanced stage, doesn't really offer any benefit to screening.
Okay, so just doing sort of a self-screening, and if something pops up, then we contact our doctor.
Certainly.
That's really the best way to go.
I mean, testicular examination should always be a part of a routine examination during a checkup.
Okay.
But routine screening isn't generally recommended.
Gotcha.
One of the most important contributors to being diagnosed in a timely manner is presentation to the doctor when a mass is appreciated.
Gotcha.
Unfortunately, diagnostic delay is a real phenomenon, and men are typically young when they are diagnosed, and they may fail to present because of shame or denial, embarrassment, lack of access to health care. Those are all factors.
Gotcha. Okay, guys. Well, for more information on this, if you were concerned, want to speak to a doctor about it, head over to casa.com. We will have all the links there.